Okay, just waiting for anybody else that's going to come in, and then we'll get started. Has anybody else attended any other lectures this week? Christina, you have. Good. So this is the lecture you're required to come to for this HESI review, but I'm starting to post recordings. Apparently the last post that I just did a few minutes ago with Professor Price is actually Dr. Lundy's review again, so I apologize. I'll get you guys that correct link after class. All right, so you would have 3 so far then. You would have Dr. Lundy's, you would have Professor Price's when I get you the right link, and then you'll have mine after today. And there's still 4 other professors that hopefully will post their recordings, and I'll get those to you as well. Okay. And then remember, you have the full schedule. I think there's 12 sections this week. Well, today's Wednesday, so whatever sections are left, there's sections, I believe, on, I don't know if there's any sections on Thursday, but I know there's several on Friday. All right, so yeah. So whatever you can get to, and whatever recordings you can listen to. And we're all basically covering the same information, maybe just in different formats. Okay. Let's see, what do I want to go over? Is everybody scheduled for their HESI? Okay, the only students I want to hear from as far as HESIs is if you're having trouble. Okay, all HESIs are scheduled on campus. So if you're having issues, get with your campus and find out why you can't get it scheduled. But
I don't see mine on the HESI site.
Pardon me?
I don't see it. It's not there for me to schedule it.
Okay. You have to change your cohort.
My cohort?
Yeah. Make sure you have the right cohort.
Oh, I'm gonna try it.
If you don't have the right cohort, it's not going to let you schedule. Okay. Hey, let's see. We're waiting for a couple more students, but we'll get going so I don't hold everybody up. Okay, so HESI we just talked about. Attend other reviews we talked about. Has anybody heard about Course Hero?
Yes.
What do you know about it? No, go ahead. What do you know about it?
You can find homeworks and stuff like that to help you out, I guess, and study guides.
Yeah, sometimes exams. So when I went on Course Hero over the weekend, I found my study guides. So I guess what I'm trying to say is I would stay away from that site if I were you guys. Okay. Stay away from it. Yeah, I found my study guides. It was awesome. So that's just yep. Should be scheduled for HESIs. Let me know when you're done. Oh, so after you take your HESIs, let me know when you're done. I mean, I can go in and pull grades, and I am all next week. I always like to go in and see what you guys have right away. I can't wait. But let me know when you're done and how you did. And then the other thing too is I can't put your HESI grade into your grade book until you have completed your remediation. So if you want to let me know when you're done remediation, that's great. But I check daily, if not more, next week. And as soon as I see your remediation is completed, I'll put your grade in the grade book. Okay, but if you want to give me a heads up that you did it, I'll go in and check and post your grade. Okay, so we in community aim for 1,300. Can you guys do it? Sure you can. Sure you can. So remember, the HESI is very case study focused, very next gen focused, very clinical judgment focused, right? Anybody surprised about that? Nope, we've been talking about that all term. That's next gen style now. Okay. With regards to if you have any outstanding, well, number one, if you are seeing a 0 in the grade book for an assignment, and I only have a few of them outstanding in this class, please check my comments. It's either an NCLEX exam that I can't see, it won't upload. I have a student who posted a screenshot. I can't accept a screenshot. So if you're seeing a 0, please go in and see what my comments were under your assignment submission. There's not that many, but there are a few. Okay, there was somebody turned in a vulnerable populations assignment that was blank. So again, just double check on your submissions. Okay, I'm sure whoever that was just turned in the wrong one. Okay. I would like to congratulate everybody on exam 3. Were you guys happy with exam 3? Is that a lot of yeses? You
Yes,
guys did fabulous on exam 3. Fabulous as a whole. So really proud of all of you. I met with a lot of you to go over exam 2, and I even met with students that wanted to do a quick review before exam 3 of things in the study guide they still didn't understand. And so I appreciate everybody's commitment and motivation. I know you're super busy, but I think it paid off. Very, very pleased with the grades. So let's just keep that mojo going for your HESI. Okay. So I know that you have a big HESI study guide. I'm not pulling that up today. I have a spreadsheet that I want to review with you, which is topics that have been on the HESI. So know that your study guide is broken out into different concepts. We've covered all term, right? Right? And so I'm going to review a spreadsheet with you that will just reinforce what's on your study guide. Now, if you haven't looked at your study guide yet, or you're just getting into it, it can be pretty overwhelming. It's 60 some pages, right? But that was meant to be given to you early in the term so that you could be following along, right? So don't be overwhelmed if you're just getting to look at it. That's 10 weeks of content. Okay. What else do I want to tell you about HESI? Let me know how you did when you're done. Homework we talked about. Scheduling. Oh, pull out all your study guides as well. Pull out your 3 study guides from your 3 exams. Okay, so what you should be using is your paper study guide, your little booklet. Pull out your 3 exam study guides, and then this review. Okay. Questions before we get started? Okay, I'm going to share a document with you. I'm hoping to share.
I do have a question. How do we change our cohort? Because I believe I'm in the wrong one.
Isn't it just a drop down?
No, if I hit change, it in the drop down, it only shows like what current one I'm in.
Well, you should be in your current cohort to schedule your HESI.
Well, the classes that it's showing is psychology, management,
Okay.
and the exit. So that's not the classes that the 3
Okay.
classes.
So Devin, you need to go back and talk with your campus.
Okay.
Because I can't see cohorts, but all I know is if you can't see your cohort, you may be see your exams, you may be in the wrong cohort. Can
Do
anybody
some of my
assist
current
Devin?
classmates know?
Yes, that was happening to me. So go where it says your name, Devin, click it. Where it shows your cohort, mine was showing June. So just clear it. And then go to the home page, refresh it, scroll down, and it's going to show you all the HESIs, and then you'll be able to register for both.
Okay, so you said hit the one that says June or
Just say put clear cohort, like don't just clear it. So it
Okay.
shows you all the HESI exams
so clear and then go back
to the home page, and then it should come out.
Okay, thank you.
You're welcome.
Can you guys see that spreadsheet? Anyone?
We don't see a spreadsheet. It's a
See two
your-
kids.
Oh, you see
Yeah.
my cute grandbabies. Okay.
Very cute.
Oh, thank you. They're a nightmare. But they live so far away. They live in London. So, okay, how do I get this down off my top screen to bring it into this screen? Okay, let's see if I can pull it up here. I have another screen now, and so I'm trying to get used to looking at it. Maybe I should try and, so how can I get this down here? Oh, here it just came up. Okay. Can you guys see that?
Yes.
Oh, geez. You could. Okay, hang on. Start this process again. Can you see that?
Yes.
Okay, great. Okay, so this is a spreadsheet that we developed for topics that are on the HESI. Okay, it's, if you can see across the bottom, this goes right along with your study guide that you have, except 2023 losers. It's a community section, vulnerable population section, disaster, child development, geriatrics, infectious disease. Okay, so
Will we have next gen questions on our exam?
Yep, you will. So anyway, this is a compilation. We'll go through each of these topics on these different spreadsheets, and we're going to go through. These are the topics that are on your HESIs. Okay, so we've reviewed the last 2, 3, 4 terms of HESIs. We don't know what the questions are, but we do know what the topics are. So as we review these topics, let's think about what we may be asked. Okay, I'm going to start with the first one. And again, I'm not going to go through the whole 60-page booklet. This, what we're doing today should supplement that. Okay, so take note. These are the topics. I'm starting with 2023 losers. I'm not calling anybody a loser. Okay, I'm just saying these are the topics that students did not do well on the HESI. All right, can everybody see this topic for review and consideration 2023?
Yeah.
Okay. Okay. First, so these are the topics that were not scored well. Assessment. How do you validate an assessment? What is an assessment? And this is an interactive session. I don't want to start calling on people, but this has to be interactive. This is for you and for your review. Really, kind of all of these topics you should be able to talk about off the top of your head because we've covered them all over the last 10 weeks.
So you're gathering information about the patient in the community setting.
Mm-hmm. Okay. How do you validate that your assessment information is correct? This is the topic, validating assessment.
You evaluate outcomes.
You evaluate outcomes, yeah. You evaluate the information you're taking in is correct, right? What about community project design? How do you design a community project? What are the most important things to remember for community project design? What has to happen first?
You have to know the limits of the community.
Before that, think you're
That's
AdPi. Before that,
You have to choose the community that you're going to work on.
exactly. Gianna, select your population, right? You need to select your population first. Okay. Community risk findings. What are risk findings? What might you find in the community as risk findings as you go out and about in the community? What are you going to find? Your silence is worrying me. When you're doing your community assessment, what kind of risks might you find?
Drugs, violence.
Yep.
Low income households.
Yep. Maybe populations with substance abuse. Think of all the vulnerable populations we talked about. Community members with mental health disorders, substance abuse. What else? Abuse, victims of abuse, human trafficking. What's an epidemiological triangle? What is that made up of?
Are you talking about the agents, the host, and the environment?
I am, yes. Can somebody give me an example of an agent? What's the agent?
Would there
COVID.
be like the vector or no? Is that the same? Would
Say that again, Christina?
that be like the vector, like a tick or something?
Yeah, the virus, the bacteria. Yeah. What's the host?
Like the person.
The person.
And what's the environment? What factors can the environment have on the agent and the host?
So certain viruses can they'll be worse in the heat or in the cold. They'll be more susceptible to it. Like she was mentioning about the tick, like with Lyme disease, it could be you're in the woods or something like that with long grass, it's overgrown. So it's more prone for that kind of stuff.
Okay. You have to be able to distinguish between an agent, a host, and an environment. If you're asked a question, it is covered. It is asked about on the exam. Each of these lines represents a different question on the exam. So you have to be able to tell the difference between the three, the triad that makes up the epidemiological triangle. Why are they asking about flu vaccine? Why is it a priority?
Because new strands are discovered every year.
Okay. Why is it a priority to get the vaccine? Is the vaccine primary, secondary, or tertiary?
It's a highly contagious communicable disease.
Mm-hmm. What are vaccines? Primary, secondary, tertiary?
Primary.
Why?
It's preventative.
Okay. Are there certain populations that maybe we should be prioritizing?
The elderly and immunocompromised.
Yep. Yep.
And kids.
Yep. When we are setting up programs in the community, what does it mean what part of the AdPi is goal setting? Think of outcomes. Outcome identification, goal setting. What do you want to happen? We're going to set up a diabetic teaching program for the elderly. What goals do we have? What are their outcome? What do they want their outcomes to be? So what part of the ADPI is this?
It's planning.
Before planning.
Diagnosis.
Yep. That's where goal setting and outcome evaluation happens. You do your assessment, you decide what your goals are, your outcomes are, and then you start planning towards that, right? Remember, you have to be able to take your ADPI and shift it into the community setting. You also have to be able to, I would go into this HESI with your med surg hat on, your PEDS hat on, your Jerry hat on. Okay, because this HESI is taking all those classes and information you've learned in those classes and topics and concept and applying it to the community. All right, so you're going to have to bring lots of tools into the HESI. Okay, what about endocrine? Outcome evaluation. What's big in community with regards to endocrine?
Diabetes.
Diabetes. Outcome evaluation of diabetes? How do we do that? Do they have the right foods? Do they have the right equipment? Do they have the right education, the right tools to, I guess maybe the question could be, how do you evaluate that a diabetic client is able to take care of themselves?
We surveyed them with questions about how they're living with diabetes.
Mm-hmm.
Could it also include like management of symptoms?
Yeah.
What about location where the patient lives, if they're able to go to their doctor's appointments, like for this case, diabetic patients, podiatrists, just even getting their insulin or any medical attention?
Right. And if you were doing a physical assessment in the home on a diabetic patient, what kinds of red flags would you be looking for? Physical assessment.
Wounds.
Wounds. What else? What about really looking at their feet?
So open toe shoes, make sure that they're wearing closed toe shoes.
Yeah. Just think about this outcome evaluation. So I'm just thinking about if you are evaluating the outcomes of a diabetic patient in the community, what would you be looking for? That's what I think that question might be about. And again, I don't know these questions. These come from a big 1,000 bank like the NCLEX. These are the topics. So hepatitis A risk. What are we looking for there? Who's at risk for developing hepatitis A?
Drug addicts.
Okay. And how do we assess the risk? Remember, these are questions that were scored very low in the last couple of HESIs.
Isn't the hepatitis A like the foodborne stuff? Like hand washing is important.
Okay. Okay. Anybody else want to add to that? This next section is about reproductive immune hematology. So they're asking about secondary prevention, HIV. What is that? What would be a secondary prevention?
Screening. Ow, you scratch.
Screening about what?
HIV.
Yeah. Yep. I'm going to put you guys on hold for 1 second. 1 second.
So that last question could pretty much, it might be identifying a patient that would maybe you would want to, like identifying which patients would be at risk for developing HIV.
Yeah, because secondary is like screening and stuff.
Yeah, so maybe it'd be like a question on which patient would you want to screen, or just identifying the types of patients that are more at risk.
Right, like
Have you guys tried your best grade?
It's
No.
okay. I mean, it doesn't generate, it just gives you the same questions over and over.
But those questions are on there. I
Are
just
they really?
yes, those questions are on there. Mhm. I was just doing the community one last night, 1 and 2, and the second one is way harder than the first one.
You said it's called Your Best Grade?
Yeah, it prepares you for HESI and it gives all the specialty HESIs. So
That's good. Have y'all heard of UWorld?
Yes.
Yes.
what's
UWorld's
that?
really good. It's
It
a
only prepares you for NCLEX though. So your best grade actually does prepare for the actual HESIs. So UWorld is only for actual NCLEX.
yeah, because I'm actually a PN right now. I'm an LPN, and before I took my my last NCLEX to get it, I practiced with UWorld, and it helped tremendously for the NCLEX. So maybe not for the HESIs, but once you graduate and start looking towards your NCLEX, UWorld, at least before the next gen, it was pretty good. I'm not sure about now.
Archer with that hand in hand with the UWorld Archer, because it's like, I think that's more of like next gen questions, but I mean, questions are questions, right? Like anything can help at this point.
Exposure.
So, yeah, going back to your HIV question, I would assume it would be like drug addicts, like sharing needles, like promiscuous, like sexual part, like a bunch of sexual partners. And that would also be like fall into the category of like screening for like HIV or whatnot.
Yeah.
So
I don't know if hepatitis A is. I mean, I think you can get it sexually transmitted, but I don't know about. I mean, I guess maybe needles, but it's usually like we had a big outbreak in Stewart, and it was all food, like people having like feces on their hands and stuff.
it's like
But I
contaminated.
could be wrong. It's very gross.
I apologize for that. That was my grandbaby FaceTiming me from Chicago Hospital. He had a hemispherectomy last Friday. He had a stroke at birth, perinatal stroke. And so I know. So he developed infantile spasms over the last several months, and the medication couldn't control his seizures. He's 10 months. So he went to Chicago last week with a really interesting doctor at Lurie Children's Hospital in Chicago. And she actually did a hemispherectomy, go figure, endoscopically. So anyway, he's 5 days post-op now, and I haven't talked to him in a couple of days, and he was just FaceTiming, so I just wanted to say hi. So he's doing really, really well. The drain's already out of his head, and he's looking to maybe come home in a couple of days. So anyway, sorry for the delay. I apologize. I couldn't miss that call.
It's okay. I'm glad he's doing better.
Yeah, he looks great. He looks great. It's been a rough week. Yeah. Anybody know what a hemispherectomy is?
I've never heard of it.
So a hemispherectomy, we have two hemispheres, right? And his stroke damaged two lobes on the right side. It damaged the occipital lobe and the temporal lobe. And so they used to do a hemispherectomy and just take out the whole side, but then they found that the heads grew kind of asymmetrically. So now they leave the side in. So they took out the two damaged lobes. They left the whole right side in, but what a hemispherectomy does is shuts it off. So they shut off the right side of his brain, which is where the seizures are coming from. So they essentially turn the lights out, and it's permanent. So they hope that the left side, and they think the left side's already picking up for quite a bit of the function of the right side. So yeah, so they essentially just shut it off, shut one side off. So it was a pretty big surgery. It was like a 10-hour surgery last Friday. So yeah, anyway. Okay, so thanks for letting me take that call. I apologize. Okay, let's go back to sharing. Okay, so we talked about hepatitis, secondary prevention. Christina named how do we screen for HIV? What is a secondary prevention? That's screening. I'm on line 12. I would suggest that you read the whole section in the study guide about TB. There's a lot of questions about TB. Okay, so how is it diagnosed? If you get a positive, what's the next piece of follow-up? There are medications to go on. How long are you on those medications? That is all in the study guide. There's a whole section on TB, and I only know that because I wrote that section of the study guide.
So I didn't realize for TB, you can't refuse medication. Like you
No.
can't refuse it. Like you'd
No.
have to do it.
No, in fact, in home health, Rebecca, it's a mandatory home visit. You know, you have voluntary visits and involuntary visits. Usually involuntary visits are maybe court ordered or whatever, but TB is one that is not voluntary. You can't say, I don't want you to come.
And so if that's the case, would they imprison you? Like what would
I
happen
don't-
in regards to that?
That's a good question. I don't know how far they'll go, but public health is required to follow up with any family or family member that has TB to make sure they're taking their course of medication, which can be up to 9 months. So please read the section of TB in your study guide. Okay, what do we think they're asking about? What's polypharmacy? We're in Jerry now. So this topic is geriatrics, med administration, basic nursing skills, self-administration, safety. That's the topic. What's
polypharmacy?
What?
Oh, sorry. Polypharmacy is basically where the patient is receiving medications from different pharmacies and trying different herbal treatments. So we don't necessarily know how to pinpoint their health treatment or what's causing something because we can't really pinpoint all the medications they're using. And sometimes they can have 2 prescriptions of the same thing from different doctors who don't know that they're already on something, just this, like 2 diuretics, just with different names.
Yep. So absolutely. And so here they're asking about safety. So Devon's already starting to describe what do we have to be looking for in the home if we have a geriatric patient who is using a polypharmacy. Just like Devon said, we have to make sure we don't have a duplicate of medications right? What are you looking for? What are you looking for in the geriatric patient that has lots of medications from different pharmacies? How are you going to keep them safe?
Checking for like drug interactions and stuff like that.
Yep.
For instance, a lot of people don't know that certain medications have Tylenol in it, and you can overdose very easily on Tylenol.
Yep. Okay.
Also duplicates and expired meds and whether or not they have any OTC like herbals and stuff that could be causing a reaction as well.
Okay, great.
I work at an urgent care, and then this lady came in. She was supposed to be on antibiotics for 14 days, but yet I think she was like maybe 3 or 4 days into it, but yet she had like 3 pills left. So she must have taken too many of her antibiotics, and her blood pressure was high. So we're thinking that she might have not taken her blood pressure medication and just kept taking
antibiotics, sure,
by accident. So.
Right. Well, this is a question on the exam. Something about polypharmacy. How do you maintain safety? Line 15, geriatrics again. This is med-surg, basic nursing skills, safety, diabetic complications, home care. What are we looking for? What do you think they're going to ask there? Maybe how to identify potential complications of diabetes when you're doing home care? Another geriatric question. This is pathophysiology, professional issues, Basic nursing skill, hygiene, safety, leadership. Why are they asking about diabetic foot care? Or what might they ask about diabetic foot care? What do we need to know about that?
Whether they have like any open wounds or sores, because the patient can possibly be exposed to like gangrene.
Sure.
Need amputation.
Drying between their toes and making sure they're not putting like lotion on.
Yep. Excellent. Excellent.
Very careful when trimming toenails as well, because you can give them a
Exactly.
small nick, which could very well turn into a wound.
Yep. So yeah, you covered that part. Line 18, med surg question, basic nursing skills with elimination. What's the issue with COPD ADLs at home? What's COPD? Well, let me step back. If you have questions about any kind of disease or condition, you have to know the pathophysiology about that disease to be able to answer the question, right? So refresh your memory on COPD. What are some issues with ADLs at home with COPD patients?
You get a lot
Why
of
is
shortness of
elimination
breath.
important? What do we like to monitor with COPD patients? Intake and output, right? Why?
Fluid volume overload.
What?
Fluid volume overload.
Yeah, exactly. That's exactly why elimination, COPD, and ADLs are all combined into one question. So this may be about INOs. What about ADLs in the home with somebody with COPD? How do we manage that? Do they get tired easily? Do they maybe not want to get out of bed to do basic ADL, shower, bathe, eat?
They might become short of breath while trying to do that.
Exactly. 21 through 22 are pediatric questions. Okay, nursing skills, teaching, diet, and stress. What are we thinking about here? Pediatric patient, and remember, pediatric patient can go up to 18. What kinds of diet issues, stress issues might we have with this group? What about, I think of eating disorders. What about stress? Lots of education to be done with stress management with this group, right? Daycare endemic, what do we think that means? What's endemic?
So that would be like a little localized breakout, right?
Yeah. Maybe a
So that could be
communicable
like
infectious
something
disease that keeps spreading around and around and around and around.
Pink
like
eye.
ringworm, pink eye, yeah.
Yep. Pink eye. Yep. Okay, so maybe that's something about what's some risks of endemic issues in a daycare? Hand, foot, mouth, ringworm,
RSV.
RSV, pediatrics, teaching heart healthy diet. Why are we teaching about that? With pediatric patients, why are we teaching about a heart healthy diet? And what is a heart healthy diet?
It's like low sodium, low fat.
Maybe help trying to prevent obesity.
Diabetes at a young age.
Yeah. Yeah. Let's see. Basic nursing skills, hygiene, safety with regards to long-term care infection. What are they going to ask about that? Well, it says hygiene and safe or hygiene. So maybe we're talking about how do we prevent long-term care infection, or the long-term care has a high risk of infections. We know that, right? So what kinds of skills, nursing skills, hygiene, are we gonna teach or practice? Why are they asking about bicycle safety? What is bicycle safety all about?
Wearing helmets.
Helmets. Helmets. What about diarrhea, mass flooding? I'm taking that to be that a disaster has happened. The water is contaminated, right? You have mass flooding, the water's contaminated. Why are people going to get diarrhea?
Because of the fluids, probably the water that they're drinking. That
Mhm.
So you're supposed to drink like bottled water and stuff like that.
Mm-hmm. And what are the two common GI things that can happen with contaminated water after a natural disaster, a man-made disaster? Cholera and giardia, right? What's respite care? And how is that different from hospice care? You got to know what respite care is. What is it?
We still continue the treatment, even though they're in the kind of like end of life care, but we're still doing the treatment for
Correct.
survival.
Correct. So if you're not familiar with respite care, I'd read up on it. Next is a couple of maternity questions, maternity pediatrics questions. Toddler care, breastfeeding. What do we think they're going to be asking about that? Why is that topic coming up?
Maybe about immunity.
Okay, excellent. What else?
Maybe about nutrition, like if they're getting enough, sorry.
I mean, if they're only breastfeeding?
Yeah, because like sometimes kids breastfeeding for too long and then they have no interest in food, but then they're at toddler's age, they're already depleted of actually, some foods that they have to be eating besides just mama's milk.
Right. Great.
Maybe passing on like HIV, how they are not supposed to be breastfeeding.
Yeah. Excellent.
Or it could just be on proper breastfeeding techniques, making sure the baby latches on.
Yep. Excellent. Excellent. Antipartum teaching, teen pregnancy. What are we doing here? Well, we covered this in a whole class about the risks of teen pregnancy. What's important in the antepartum phase?
They have to stay in school.
Yes.
Making sure they go to their doctor's appointments or providing that for them or etc.
Yep. Yep. So there's a question about antepartum teaching period with the teen pregnant mom. So yes, staying in all the things you just mentioned. Okay, here's a section of med surge. I'm on line 33 through 35. Med surge. They're asking a question about GI, hepatic, operative, gastric bypass, complications, home visit. That tells me that maybe you're going to be presented with a patient in a case study that has had a gastric bypass, right? What complications are you looking for?
Bleeding.
Mm-hmm.
Infection.
Infection. Yep. What about, oh, go ahead.
I think they're in a high risk for dumping syndrome after a gastric bypass.
Mm-hmm. Mm-hmm. Yep. This next one would be respiratory trauma emergency, disaster. They asked about red tag triage. What's red tag? Know the different tag colors. What's red?
Need of immediate care.
Okay. But I would review that. That's in your disaster section on your study guide. Just review what each of the tags are. Again, another med surge question about trauma, regarding trauma and emergency. It's asking specifically about anthrax incubation. In your study guide, you have a section on anthrax, and it talks about what the incubation period is. Does anybody know that? Off the top of their head? If anybody has the study guide in front of them? Anyway, know about anthrax incubation period. They're asking about that. Next three questions that weren't scored very highly are pathophysiology. First one is med surge, cardiovascular. Talking about hypertension, BP measure. I wonder, here's what I think. I think they're going to be asking about what's a normal blood pressure, what's a increased blood pressure, and what's a severely high blood pressure. So I'm thinking they're going to ask, how do you measure it? So I would know your blood pressure. Here's low blood pressure, here's normal blood pressure, here's high blood pressure. That's what I'm thinking when it says measure, BP measure. What do you guys think?
Maybe teaching for a patient per se that just got diagnosed with hypertension and when to, or that the fact that they need to start monitoring their hypertension.
Absolutely. What do we think? What are we teaching? What do we need to know about the immune system, the activation, HBV? Why are they asking about that?
Cervical cancer.
Okay.
Yearly checkups.
Yep.
Sexual partners.
Yep. Just think primary, secondary, tertiary. Okay. Not just with this, but all these lines. Okay. What about med surge question? Osteoporosis / prevent. So what are we thinking?
Weightlifting?
Huh?
Vitamin D and
weights?
calcium.
I'm thinking it would be a question about how do you help teach to prevent about osteoporosis? Right? So is that primary, secondary, tertiary?
Primary.
Primary.
Osteoporosis.
Okay. Let's keep going. Acanthosis nigricans. What is that? And how do you screen for it? And why do you screen for it?
Diabetes.
Correct. That's what we need to know about that. Correct. It's a screening tool for early onset diabetes. Right? Growth and development in the school age screen. Go to your study guide. There's a section on growth and development and what kinds of screenings are done. Whether it's height, weight, whether it's BMI, scoliosis. They also asked about ADHD in schools. I don't know what they're asking, but what do we know about ADHD in schools? Some kids are on medications, other kids are not on medications. What's one of the potential issues with ADHD children?
They can't focus, they can't sit straight, so they'll start something and then lose interest and go somewhere else.
Yep. They may forget to go to the health room to take medications. They may need reminders. Vision screening in preschool. I'm just going through this because I don't want to get caught up in too much time because I still have all these others I want to go through. School children parent focus groups. I know I did a lot of education when I was in the schools with parents about milestones, good parenting skills, strong children, resilience. Maybe meeting with parents to find out what they're concerned about at their child's age. And then immunizations. What do we talk about with immunizations? They are the most what? Immunizations are the most important, one of the most important things we can do to help prevent childhood diseases, right? Seatbelt safety we talked about, bicycle injuries we talked about, prevention. Here are some professional issues, assignments. So I'm thinking this is scope of practice, assignments in home care. Maybe what kind of clients can you be assigned to? I'm thinking this is the difference between the RN and the LPN scope of practice. Sudden community outbreak. What about community resources in the rural area? Are they a dime a dozen or are they very limited? Very limited. We talked about how do you do a community assessment? How do you obtain data for morbidity? Remember, we have data gathering and data generation, right? Data generation is we have to generate the data. We don't have it. Okay, but they're asking about data gathering, which is information that already exists, right? So you could go to wherever, your local health department, vital statistics, and gather data on morbidity. Does that make sense? Hey, legal and ethical, communicable diseases. I'm thinking that's about reporting, right? We have a legal and ethical obligation to report certain communicable diseases that are identified by your local health department or state health department that we have to report. Well, community clinic financing. What do we know about that? The only thing I can think of would be that clinics, organizations, foundations have to always submit for refinancing, right? Or re-upping the financial support. That's what I'm thinking with that kind of question, with that kind of information. All right, so I would be thinking sustainability. How would you communicate to your lender, if you will, financial backing, that you are meeting the goals that your community clinic set out to meet, right? Let's say you have to do a presentation every year. What information do you need to provide this group who is going to refinance your clinic? Okay, that's what I think about. Okay, med-surg, another 4 med-surg questions. Nursing process, priority HF lab results. What's that about? Anybody have any thoughts?
Heart failure?
What?
Heart failure?
Say that, Jennifer, one more time.
Heart failure?
Oh, thank you. I thought that's you said. Okay, so what lab results will show, or what lab results are you looking for heart failure?
The troponin levels.
Troponin. Mm-hmm. Conjunctivitis, home care. What do we know about conjunctivitis? Contagious? What do we do at home? We don't share towels. We don't. Go ahead.
Warm compress, washing your hands.
Yep. And so what are we telling the parents at home? You got to get some kind of treatment, right? Home care. Can't send them back to school or out if they still have active drainage from their conjunctivitis. Teaching about HPV, we kind of covered that, but that's the topic that's covered. And then primary prevention, cancer. So we're doing primary prevention. So I would think, what would you think we would be teaching about for prevention of cancer?
So nutrition, no smoking, alcohol.
Getting the vaccine.
Yep.
Routine screening like colonoscopy.
Yep. No, that's not primary, that's secondary.
No.
Right? If we're doing a colonoscopy, we're screening. So I think primary prevention's for cancer.
Could also be like in the workplace, like maybe like an occupational nurse, making sure that they're wearing the like masks and stuff like that in the workplace if they're exposed to dust.
Excellent, Jacob. Excellent. Okay, what about let's see, mental health, geriatrics. I'm here on line 68. Depression, grief, nutrition, So the topic is geriatrics home nutrition. What are they going to be asking about?
Maybe who cooks the food, who shops for their food?
Do they have a working refrigerator? Are any of the foods expired?
What about hygienically? Because if it's like mental health and if they're not taking care of themselves,
Yeah. How are they
Also,
preparing the food?
kind of sounds like, because it goes along with geriatrics, depression, and grief. Kind of sounds like they're maybe asking about like a failure to thrive type of situation.
Possibly.
'Cause
Yeah.
geriatrics could have lost a loved one and now they're not eating very well or something like that.
Yeah. Yeah. Great. Couple more mental health, depression, grief with the home health with the dying client. Remember, one of our questions in the exam talked about the stages of grief. So I would review the stages of grief. Maybe you're going to get a case study scenario of what stage of grief a family member. Remember the question was, they don't want to talk about funeral services. Okay, well, that's in the denial stage of grief, right? So being able to recognize depression, grief in the dying client or the family members. Okay, mental health, teaching, leadership, occupational health, and smoking. Jacob, repeat what you just said. The occupational nurse can
Teach them about prevention and
Yeah.
stuff like that when it comes to the smoking, inhaling,
Yeah.
and cancer prevention.
Maybe you're provided a case study about an occupational health nurse and what she can do with regards to primary and secondary prevention of clients who smoke in the workplace. Right? Primary, prevent, secondary, screen who smokes, and then tertiary, start to get in there and try and figure out how to get them to quit smoking. Is it programs that are offered, smoking cessation, medication, whatever? So those are the questions that were scored low on. Does that help to go through it like that? Okay, then I'm going to go through these ones. We've covered a lot of this in this first page we did, so I'm just going to run through these. So exam question specialty area and topic. Okay, so this is regards to community health in general. We talked about community assessment. Please know how to do a community assessment. Okay, we talked about the you need to, a lot of this information in these 6 tabs come right from your study guide. Or let me rephrase that. We created that study guide based on this spreadsheet. Okay, so here are the other topics that are asked about. What's the nurse's role? What does a community nurse do? Assess income. Why is that important? What if you have a community living in poverty? Might they have access to less resources? Assessing income is critical. Remember what we said at the beginning of the term. What affects the health of a family, the health of a community the most? 2 words. Financial stability. You guys remember talking about that? Financial stability is the biggest risk factor for the health of an individual, a community, a family, population. We talked about clinic financing. Family eco map. Remember what the eco map is? We had a oh my gosh, I'm drawing a blank on the other one. The eco map and genogram. Okay, but here they're asking about the eco map. Remember the genogram. This is how part of our assessment, the genogram was that genetic makeup of over the last 3 generations. Who had cancer? What kind of cancer? It's trying to assess risk. But what's a family eco map? What is that measuring? The genogram is genetics. What's the EcoMap measuring?
Like family interactions with other organizations in the communities.
Yep, exactly. Social interactions. Is this community out and about interacting with other specialties or populations or families or groups in the community, or are they very isolated? Talked about program goal setting, outcome evaluation we talked about, community risk findings we talked about, blood pressure screening. Okay, cardiovascular, we hadn't talked about this. Why are they going to ask about what does hydration have to do with exercise?
Well, you can get dehydrated when you're exercising.
So it has a lot to do with exercising.
So maybe that's part of teaching. Maybe it's a teaching question of how, if during exercise, you need to make sure you stay hydrated. Radiation exposure. So this is basic nursing skills, safety, leadership. All right, so I'm thinking this is a safety question about radiation exposure. How do you protect yourselves or protect others if you're taking care of somebody who's had an exposure to radiation?
Either that or like a radiological procedure as well.
Or yes, or what if somebody comes to visit you in the ER and they've had a exposure to radiation? What kinds of things do you do? That's in your study guide. What kinds of things do you do to protect yourself and the environment? PPE, whatever, isolation, whatever it is. Okay, with regards to vulnerable populations, here's some groups they asked about. Homelessness. What's the cold exposure risk? That's pretty self-explanatory. We know that homeless people have a risk to cold exposure during the winter months, right? Maybe they're going to ask what that looks like. What could they present with if they've been exposed to the cold? Frostbite? What about respiratory migrant worker risks? Why are migrant workers at risk for respiratory illness?
Pesticides.
Pesticides. Yes. What about community resources, rural? We talked about that. Very limited. No specialty. So think about that whole discussion about resources in the rural community. Very limited. So if they need help or chemo or dialysis, they have to travel. What are the barriers? Why is this such an issue with resources in the rural community? Here's a cultural question about Hispanics. Okay, another cultural question about Islamic faith. Culturally sensitive teaching. Talked about that up one side and down the other. Here's a mental health question. These are psych questions. Mental health, communications, battering communication. Maybe you're given a case study and you have to identify which part of the scenario is battering. What is battering communication? That's in that violence chapter. How do you
when to
identify?
report it, pretty much. So like when to report it, pretty much.
Sure. Or maybe identifying phrases that are said by a spouse or partner, whatever, that are battering. Right? Remember that chapter of how to recognize child abuse, how to recognize intimate partner violence, how to recognize that all those different boxes in your chapter. We talked about the home health dying client. We talked about abuse. Those are okay. Talked about that. Disaster. Natural disaster preparedness. What do we think is what's the two different disasters?
Natural and man-made.
Okay. How do we prepare for a natural disaster?
So you could have like a pack pretty much prepared with I think it's like it's usually like a gallon per day per
Mhm.
person. You have 3 days worth of food, battery powered radio of some sort, money, important health information,
Yep.
medications, etc.
Okay, so that's how you individually prepare as a family. How does a community prepare for a natural disaster?
Practicing like evacuations
Exactly.
and in case of emergencies.
Yep. That's those.
All
What do
out
we?
shelters, response teams, clear signs on roads for evacuation routes, stuff like that
Yeah.
too.
Yeah. Remember, we talked about a mass casualty exercise. Remember talking about that? That's how we prepare. We do annual training for mass casualties. Schools do evacuation drills. Well, everybody does evacuation drills now, depending on where you work or if you're in school, but evacuation drills. It's all about preparedness. We talked about cholera. We talked about red tag. We talked about, no, we didn't. Endemic symptoms, possible terrorism. So this is a pathophysiology med-surg question. It's specific to immune system and hematology. So what do we think they're talking about when they say endemic systems, possible terrorism? Maybe the release of
Maybe like
the
multiple
release of a
people
chemical.
showing up,
Uh-huh.
like multiple people showing up at one time to like an ER with the same symptoms or something like that. Could be like anthrax exposure or anything like that.
Yep. Good. All right. Child development. We talked about screening programs. Take a look at your study guide. Remember, this is child development, not adult, child. So go back and look through your few sections of child and adolescent for screening programs. What do we do? What kinds of screening do we do? It's different from children to adolescents. Okay. Teaching diet and stress with this group. Remember, we're talking pediatrics. We discussed that. Heart healthy diet. Go back through your study guide and look at the child and pre-adult child, or go through back and look at the sections. It's in the first couple of pages. Pre-adolescent teaching and adolescent teaching. Okay, there are sections specific to teaching with these two groups. What do we need to know? Don't worry about Healthy People 2020. Seatbelt safety, we talked about that. Why are they asking about neighborhood safe houses? What's that about? Hello? You guys still there?
We're still here.
Oh, okay. Why are we talking about neighborhood safe houses with regards to pediatrics? And remember, pediatrics up to 18 years old. What is this? What's a neighborhood safe house?
Somewhere the family can go if they need help or.
Okay. What else? Okay, well, I would encourage you to read about that. Okay, because it was asked about. Let's see, nicotine, we talked about dangers of smoking. Teaching about lice in the schools. What do you know about lice?
They could spread.
They can certainly spread. Treatment, what's the treatment? How long do they have to stay home? When can they get back to school? What do we teach the parents about washing bedding and clothes and not sharing? Another issue with kids is skin health. When I think about this, I think about like eczema or what am I thinking about?
Ringworm.
Acne, right? How do we work with the adolescents talking about skin health? We talked about AN. Scoliosis we talked about. We talked about ADHD, eczema, immunizations, immunization rates. We talked about Hep B allergy. So we pulled these lines from this part of the spreadsheet into the first part. That's why we see a lot of repeats. What about family assistance with ophthalmic medications? What do we think is going on there? Here's what I think is going on.
They're instilling all of the medication correctly, not touching the tip to the eye, and also not sharing medications between kids or adults.
Okay, Olivia, what part? Keep going and then talk about family assistance.
Especially with the cost of medication being what it is today, it can be difficult for families to be able to afford multiple medications for kids, especially if they have the same kind of illness going on.
Do they need assistance?
Right. And if you're sharing, especially if you have like conjunctivitis and you're giving the kid, eye drops or, anything like that, and the parent isn't instilling them correctly into the eye, and potentially touching the tip to the eye and then the inside of the cap and recapping it and then using it on the other kid, they can just be passing that infection back and forth between the kids.
Yep. And then I would add to what Olivia says with regards to family assistance. We just recently had a question on an exam about being not judgmental, being able to ask an open-ended question. I think it was about a blood pressure cuff, because they had to take their blood. They were recently diagnosed with high blood pressure and they need to get an at-home setup. And the question surrounded, yes, we do need to get this. Do you have the means to get it? Or what was the question? Do you need assistance in getting this? I would apply that same thought to this. Yes, we need ophthalmic medication to treat your conjunctivitis. Do you need assistance getting that medication? Right? That doesn't imply judgment, doesn't imply disrespect. Okay. Lead poisoning, there's a whole section about this we talked about. What's the prevalence of lead poisoning? So what are the 3 or 4 places you might find lead poisoning?
Old houses.
Old houses.
Especially in the paint or the plumbing of old houses or old buildings.
Well, old buildings in general, right? Schools, homes, businesses, right? We know the kids are very at risk for lead exposure. So, and that said, there's a section on that in the study guide. This section is on geriatrics. So you're bringing your whole, so the last section we just covered is pediatrics, which is up to 18 years old. Now there's a whole section on geriatrics. All right. Elder health assessment. Community senior health screening. Skin health for the elderly. Home environment safety. What are we looking for home environment safety? Risk to fall.
Ways to monitor temperature, like in the shower.
Yeah.
So that they're not burning themselves.
Yeah.
Scattered rugs.
Scattered what?
Rugs.
Yeah, rugs, furniture, anything that could be a potential fall risk.
All the plugs and cords don't have any frays or anything, and that there's nothing around potential at-home oxygen use that could cause a spark.
Yep. This line 7 talks about the geriatric population, but the topic is BKA home assessment care. So this is a below-the-knee amputation. So why would they be asking this on a community HESI? Because you very well may be taking care of a patient, right? In the home setting. that's had a below the knee amputation. So what kinds of things, what is part of your home care assessment? What are we
Finding
looking
ways
for?
they can like come off the bed, or like preventative ways to maybe they falling or something.
Night lights,
What?
night lights.
Yep. Safety. Yep. So have a good idea how to express how are you going to do a home care assessment? What are the most important things to do with regards to a home care assessment with a below the knee amputee? We already talked about polypharmacy. We talked about family assistance with ophthalmic meds. We talked about foot care. There's a question, they're asking about, it's under geriatric still, med surge, mobility and safety, and they're asking about Parkinson's home care. What do you do different with a Parkinson's patient with regards to home care? What are we looking for? What are you looking out for?
Tripping hazards.
Yep. Family support. Is there anybody in the home or are they alone? What else are we looking for? Okay, they're all also asking in geriatrics about orthostatic hypotension. Why do you think they're asking about that?
Sudden change of position, your blood pressure gonna drop.
Right. So number one, know what orthostatic hypotension is. Right. And number two, know how to care for it. As far as teaching how to either prevent it or minimize it. So what specific teaching might you do? Maybe get up slower. What else? Stay hydrated. This one should be easy. What's a secondary prevention for hypertension? Screening, right? Screening for
Monitor your blood
hypertension.
pressure.
Yeah, yeah. Cardiovascular disease with the African American population. Why are they specifically asking about the African American population with regards to cardiovascular disease?
Because men are more likely to get it, especially men of ethnic descent.
Yep.
Because we like a lot of sodium.
Yep. Excellent. Why in the world are they asking about lipid screening?
Predisposed for cardiovascular disease, hypertension, atherosclerosis.
Yep. Yep. So they're asking about lipid screening. I don't know. Why is it important? What are we screening for? What diseases are at risk for a high lipid results?
So patients who smoke too.
Mm-hmm. Yep. We talked about the heart failure lab results, flu shot we talked about. What do they want to know about the Menammune vaccine? What is that? That is not in your, that's new. That is not in your study guide. So please look that up. Assignments home care we talked about, that would be probably the scope of care, what you can assign, what use the RN can assign to LPNs, what you can assign to clinic aides or techs or whatever. Elderly relocation. I'm thinking they're asking about elderly relocation because it can be a very stressful event, right? For the elderly, for many reasons. Maybe loss of social group. Maybe they have to switch doctors. Maybe they're now living in a more isolated elderly relocation, that's in your you should know this from geriatrics. What does that create? What kind of risks does that create? You should know that from geriatrics. We talked about COPD and ADLs, long-term care fall prevention, community resources for the elderly, Meals on Wheels. They asked a specific question about Meals on Wheels. How do you teach in a client who has ascites? What do you teach for a home diet?
Low salt.
That's one. What else? Go back to your cirrhosis reading.
The liver.
Wouldn't it
Pardon me?
also be like no dairy products because they would cause more mucus?
I don't know if I saw that, remember that in there, but maybe. But go back and review your cirrhosis section for what you're teaching with regards to an ascites home diet. Talked about gathering data. Okay, the last section was infectious disease. CDC reportable diseases. I don't think you need to know, I don't know if they're going to ask specific diseases, but knowing that CDC requires a certain diseases to be reportable. But I would have an idea of the most common reportable CDC diseases. What do you think they are?
Gonorrhea.
Mm-hmm. STDs? Mm-hmm.
Tuberculosis.
Mm-hmm. Any of the childhood diseases, measles, any hepatitis. So I'd have an idea. That's in your, I think that's in your last study guide. There's a section in your last study guide about infectious diseases and what's reportable. We talked about anthrax incubation, SARS.
1 to 7 days.
For what?
For anthrax.
Oh, good. Oh, so Devin looked it up. Okay.
And the incubation is typically 3 to 7 days for gastrointestinal form.
Okay. We talked about flu vaccine priority, TB skin test, and then screening x-ray. So definitely review your section on TB. Okay, so that was a lot of information. But if you put this recording together with your study guide and with your HESI study guide, and then pull out your 3 study guides from your 3 exams, that's what you need. I mean, we have given you every topic that's being covered on the HESI. There may be some new next gen questions on there, but for the most part, after reviewing 3 or 4 terms worth of HESIs, those are the topics they're covering. And again, I don't know the questions. And if you were taking screenshots of it, that's fine. Just think about, what are they going to ask me about that? Why do I need to know about elderly home nutrition? Okay. Kind of like the
Are
same
you
thing we
gonna
do in
be-
reviews for exams.
Are you going to be posting the study guide today?
You already have the HESI study guide?
Mm-hmm.
You got that weeks and weeks ago.
I don't see it.
Weeks ago.
I do remember seeing it, but could you resend it? Because I couldn't find it when I was looking the other day.
Can somebody look back on their announcements real quick? Because I have to go right to teaching I have to give an exam in 15 minutes. So could somebody go back to their announcements and tell Kim what date I send that HESI study guide? It's probably in maybe week 3, week 4, maybe. Well, you guys, or Jacob looks like he's searching for it. Do you guys have any questions? Has this been helpful? Yes, no, too
Yes.
much?
No, it's fine.
I mean, it's right on target. What's going to be on there? So other than your 3 study guides from the exams, your HESI study guide, and the recordings, that's it. If there were a few things that we went over today that you still need to read up on, go back to your, like the ascites diet. Nobody could really help me other than low salt. Go back and read up on that section. But other than that, you have all the tools you need to be successful in this HESI.
Yes.
You guys have the HESI study guide, right?
No, so I also can't find it because I had to ask a classmate of mine if they could send it to me. So I'm also trying to look to see, you said week
I'm
4 and
on the
3.
announcements all the way back to week 1, and there's nothing that I'm seeing.
Yeah, Olivia, we're meeting tomorrow. I can give you a copy because I was able to print out mine. It's me.
Who said
Where
that?
did you find it, Medora?
I forgot what week, but since Professor Marvel sent it, I printed out right away. So
Mayona, when did I send that? I know I sent it.
it says it was revised on February 5, so it's probably on sometime in February 5.
I know I've seen it.
February 5th, you said?
Yeah, it was the document says it was revised on February 5, so it's probably closer on that date.
Okay, I
It's
found it. It's week 5 announcement information, and that's under it.
Okay.
Oh, there it is. Okay.
I was about to have a heart attack. And I think I sent it and said this is the updated version because we even put in some other information from last term's HESI.
Yeah, it says revised February.
Yeah, revised.
Yes,
Yeah.
ma'am.
Oof. Okay. So Kimberly, Kim, did you get that?
Yeah, I remember seeing it earlier in the semester. I just couldn't find it because I was looking for it yesterday and I was having a hard time finding it. But yeah, I found it.
Okay, all right.
Thank you.
You're welcome. Okay. Any questions? I'll send out a recording of this if you want to go through it again, but this spreadsheet is, I think, like the bomb, right? It just is so specific on what topics are covered. So that's what you need to focus on. Okay, don't go back and read all your chapters and read all your PowerPoints. We're beyond that. Everything's summarized in the study guide. And then this spreadsheet further summarizes it into specific topics. Okay? Week 5 announcement. Thank you. All right. Does anybody have any questions? I need to get going here in a few minutes. I have to do an exam. Please try and attend any other sections this week. You have the master schedule. After I finish in a couple hours with this exam, I will repost Professor Price's recording. Okay, so sorry about that. And thank you. Let's see, I can tell you exactly who mentioned that to me. That was Jennifer. Jennifer mentioned to me, Professor Marvel, you sent out Dr. Lundy's recording again. So I'll get that changed up today. Okay?
Thank you, Professor.
Well, this will be the last formal meeting, our class time. I've really enjoyed having you guys in class. I really have. I hope you've learned a lot. I hope that community looks different, or you have a bit more of an exposure to how involved community nursing is. And, like I said, we're taking care of patients in the community that are being discharged from the hospital. So, anyway, it's been a pleasure having you guys. I've really enjoyed this class.
Thank you.
Thank you so much.
Thank you.
Yeah.
Thank you.
And then you guys got my email. We're kind of technically supposed to meet for like 10 to 15 minutes in week 12. So if you just want to pop in, we can talk about maybe just say, okay. You guys know what I'm talking about, right? Okay. Just pop into any of those times. We'll meet for a short
We're
period of
not
time.
meeting week 11 at all.
No, you have HESI.
Okay.
Nope, we're not. Yeah, good luck to everybody on their HESIs. Let me know how you do. Please. I'd love to know how you do. And I'd love to know when you finish your remediation too, so I can get your grades posted for you. And as soon as you get those, well, you guys are busy next week with 3 HESIs, but as soon as you get the remediation packet, if you've done well in your HESI, it shouldn't take you long at all. Just knock it off. Okay?
It shouldn't be less than more than an hour for all of us, because we're all gonna do amazing because we just reviewed it.
Absolutely. I can't be any more specific than what I just did for the last hour and a half. You've got every single topic that's going to be on a question or that's going to be covered. Okay? So good luck to everybody. Reach out if you need anything. I can't wait to hear about your great grades. You're welcome. Bye.